Please lie on your back. If you have belts on, undo them. If you have shoes on, take them off. If you have spectacles on, take them off. Put them somewhere safe so you won't be thinking about them. Or put them in a case. So our medium in what we're doing here is ourselves, our body. And our method, you could say, is movement. But basic organic movement that is fundamental to us and was fundamental to our development. There's no program for crawling. There's no program in our brain that we were born with for standing, rolling. These are all things that as children, as infants, we developed and learned through our own sensory experience. And that's exactly the kind of learning and relationship to ourselves that we're going to use here. So please take a moment to observe your contact with the floor. First, feel, for example, your right foot, and bring your attention to where your foot is touching the floor and where it's not. And then you slowly move your attention up your right leg in a uncritical, non-evaluative way. You just alternate between feeling the inside of your leg and the outside. The outside is where you have contact with the floor. The inside is your musculature. And do the same from your left leg, just slowly, beginning with your left heel. Seeing if you can observe yourself without interrupting your breathing. Our assumption here is that we are at every moment an integrated whole. You directing your attention, you'll find influences your breathing. And of course, likewise, your breathing influences your attention, your ability to sense yourself. And then your lower back. Just observe if one side of your lower back is further away from the floor than the other. And then slowly move your attention up your back, up your spine, just feeling where you make contact with the floor and where you don't. You're not interested to change anything or improve something, fix something. You'll see that the less you try to improve, the more effective the lessons will be. Then you feel behind your neck, there's a little gap there between your neck and the floor. Unlike the middle of your back where your spine is pressing into the floor, behind your neck there's a a space there. Your right shoulder blade, your left shoulder blade. And feel, is one shoulder blade more in contact or less? Does one shoulder blade feel lower or higher? More forward or more backwards? And your right arm, and your left arm, and now slowly bend your knees and stand your feet and separate your feet about shoulder width apart, and just very slowly tilt your pelvis the tiniest bit toward your head. It means maybe a movement of, I don't know, a half an inch. If you were to have a little light on your tailbone, maybe that little light would move. Yeah, a half an inch, 3/4 of an inch. You just tilt your pelvis a little bit toward your head. Of course, your coccyx, the last few vertebrae of your sacrum, of course they tilt toward your head a tiny bit. And you tilt your pelvis a little bit toward your head, and then you simply let go and rest for a moment before doing that again. So it's not a repetitive movement, but rather very simply tilting your pelvis a little bit toward your head. That's it. And then you relax, and of course your pelvis will return to what you might call the neutral position. And then you pause for a moment before doing that again. And see if you can exhale as you tilt your pelvis that little bit. And of course, if you bring your attention to your lower back, you can feel that somewhere in your lower back, that part of your spine goes closer to the floor. Even though your tailbone is coming away from the floor, your lumbar vertebra, the largest vertebra of your spine, are tilting a little bit toward the floor so that the gap in your lower back, between your lower back and the floor, becomes less. That's right. Now, you can feel that as you do that, your feet press against the floor. You feel that? Your feet press against the floor, and that's what's tilting your pelvis, that little bit. Only that small, but again, it's still just a half an inch or so. And try doing that movement as you exhale. And feel, let your attention, obviously the movement itself is easy. So you just let your attention move about yourself, and you feel where you can do less. Less with maybe you're doing something with your hands or your arms, maybe with your jaw or your tongue. You just feel where you can reduce the muscular effort within yourself. Now, you can feel that your feet are pushing against the floor, And you might be able to feel that one foot is pushing a little more than the other. So you just make a guess. Make a guess as to which foot is pushing more. And you intentionally push that foot a little more against the floor, so that your pelvis, maybe put your hands on your pelvis. That's right. And so, for example, if you're pushing your right foot a little more, intentionally so, you can feel that your pelvis tilts a little bit to the left, doesn't it? Or if you're pushing more with your left foot because you guess that that's what you were doing yourself spontaneously, you feel that your pelvis tilts a little bit to the right. So you just choose which foot you guess you're pressing more with, and intentionally press more. That's right. Still just simple. And see if you can feel that when you press that foot a little bit more, you can follow that movement from the foot toward the diagonal shoulder. So you feel when you press with the right foot, see if you can follow the movement from your right foot to your left shoulder. And if you're pushing with the left foot, you see if you can follow that movement towards your right shoulder. It's very subtle, it's very small, but you just observe. You'll find that you don't need to try to improve the movement. The movement itself will improve without you doing anything. Good. Now stop and stretch out your legs. And remember that 10 minutes ago or so we observed our contact with the floor, and you just turn your attention in that way towards yourself again, and you just feel if somehow your contact with the floor of one shoulder blade or one side of your lower back has changed. And bend your knees, stand your feet. And now slowly, intentionally, you still push a little with both feet, but intentionally push the other foot more against the floor. And you can put your hands on your pelvis and see if you can observe that little tilting motion, that somehow the way in which your pelvis is lying on the floor is being influenced by the fact that you're pushing one foot a little more than the other. 20% more. And now see if you can follow the pressure from that foot toward the diagonal shoulder. That's right. And now press both feet and just feel if something is a little different than when we started. And if you can, as you push both feet against the floor, to tilt your pelvis toward your head, just observe if you feel that movement go up your spine. Now, this is a situation where if you have things behind your head, if you have many things behind your head, it becomes very difficult for that movement to, because of the way your spine is curved, it becomes difficult for that movement to really go up much. So you just see if you can have fewer pads behind your head maybe just one. That's right. Okay. Now, this time, you do the same thing, using your feet against the floor. You tilt your pelvis, and then now lift your pelvis so that one or two of your vertebrae of your lower back lift away from the floor. So then you lift, and then you very slowly take your pelvis back to the floor. And then you pause, you rest for a moment, and then you do that again. You push your feet towards the floor to help you to lift your pelvis forward, meaning toward the ceiling. And you lift, you could say, oh, I feel the lumbar vertebra, the last vertebra of my lower back lift up, and then the next vertebra lifts up, and then maybe you take your pelvis back to the floor. Just slowly. See if you can organize your feet so that you feel that you're pushing more or less equally against the floor. And then you lift, you tilt your pelvis toward your head, and then you lift 1, 2, maybe even 3 vertebrae off the floor, and then you lower them back to the floor. But as you're lowering them back to the floor, you do it in the reverse order, that your pelvis, that the vertebra lifted away from the floor. So, for example, if it goes, you tilt your pelvis, then your sacrum lifts away from the floor, and then your 5th, 4th, 3rd lumbar vertebra, and then you put them back. The 3rd one is the first one to go back to the floor, and then the 4th, and then the 5th. So it takes a certain amount of controlling the going back, return to the floor. As you exhale, and as you continue this, you could call it almost a practice of using your attention to feel where you can do less. So you turn your attention inward, and rather than trying to do more, rather than trying to make the movement larger, you actually feel where can you use less muscular work. There's no reason to tense your hands or your shoulders. And now see if you can lift another vertebra away from the floor. But you lower it 1 vertebra at a time back to the floor. Just what's simple. As an infant, you did this thousands of times. Obviously, when we're born, we have no idea how to use the ground. No idea at all about how to stand our feet and to use our feet to push up. All right, now stop, stretch out your legs, and just observe the contact of your lower back with the floor. And the movement of your lower abdomen when you inhale. So you have 5 lumbar vertebrae. Some people are born with 6, but most of us have 5. And then you have 12 what are called thoracic vertebrae. All right, the vertebra that, to each of those thoracic vertebrae, there's a pair of ribs attached. One on the right side of the vertebra, one on the left side. And then those vertebrae, except for those ribs, except for two of them, they come around and connect to our breastbone. And then above that, you have 7 cervical vertebrae. Again, some people are born with 8, but most of us have 7. And bend your knees, stand your feet, separate your feet about shoulder width apart. Now, as you do exactly what we've been doing, lifting your pelvis up away from the floor toward the ceiling, you press your right foot more than your left. And just observe, again, put your hands on your pelvis and observe as you lift your pelvis and you push, you use your feet to help you to lift your pelvis, but push your right foot against the floor more than your left. And can you feel that your pelvis tilts a little, doesn't it? You feel that? It tilts towards where? To the left, of course. And towards your left shoulder blade. You feel that? That there's a little bit, when you tilt when you lift and you push more with the right foot, you feel a little increase in the pressure of your left shoulder blade. Now push with your left foot against the floor, or your left foot more than your right, and see. Now, of course, for all of us, pushing one foot against the floor is easier than the other. You feel. When you press the left foot more than the right, you feel your pelvis tilts to the right, and a little more weight goes onto your right shoulder blade. You feel it. See if you can feel that. It may be subtle, it may be small, but you'll see if you have your hands on your pelvis and you observe the change that happens as you push more with one foot than the other, you'll feel there's a little tilting. Now, this time when you lift your pelvis towards the ceiling, you press the right foot more than the left. And then you lower your pelvis, and then the next time, press your left foot more than your right. So you alternate like that, and then you'll find, one of my feet presses more, what would you call it, effectively or easily against the floor. Of course, it's not because you can't press the other foot the same amount. It has to do with, of course, the organization of your spine and your neck, your chest. Good. And rest again. And stretch out your legs and just observe if something's changed in your contact with the floor. Maybe your spine is more in contact, or maybe something's changed in your shoulder blades. Bend your knees. And now turn your head to the right, as far to the right as you can, meaning that your right ear is facing the floor, and lift your pelvis like that a few times, and you'll find that just because you have your head turned to the right, your right shoulder blade is pressing more towards the floor. So you turn your head to the right, you leave it, and then you lift your pelvis just what's easy toward the ceiling. That's it. And now bring your head to the middle and see if you can feel your right shoulder is more flush to the floor than your left. Now turn your head to the left and do the same thing. You lift your pelvis toward the ceiling. That's it. You feel that turning your head to the left pushes the head turned like that, of course, turns your chest, and your chest turning presses your shoulder blade against the floor. Good. Bring your head to the middle and just rest for a moment with your knees bent. And again, raise your pelvis as high as you can off the floor, but just what's easy. And now see if you can put your hands on your pelvis and slide your pelvis to the right. See if you can slide your pelvis to the right and then bring it back and then slide it to the right, maybe 2 or 3 times, and then you rest. So you keep your knees towards the ceiling, and you translate your pelvis to the right. Translate means that your pelvis doesn't turn. That's why I ask you to put your hands on your pelvis so you can feel what you're doing. You lift, and then you slide your pelvis to the right. And you can feel, if your pelvis doesn't turn, you'll feel that the right side of your chest gets a little wider when you do that. You see if you can feel. Each time you slide your pelvis to the right, something gets wider on the right side of your chest. Now, as you slide your pelvis to the right, you feel if something changes in the relationship of the back of your head to the floor. And you'll feel that the right side of your neck actually gets a little longer when you move your pelvis to the right. If you don't turn your head, if you just leave your head in the middle, you feel. That's right. Good. Rest a moment, stretch out your legs, and just observe. That was maybe, 6, 7 movements to the right. Can you feel? Something's changed in the right side of your lower back. That's how fundamental these movements are. You don't have to do it 20 times, 30 times, repetitively, but done 5, 6, 7 times with attention, it's enough. Because these movements are basic, fundamental, essential to our ability to move, to stand. Bend your knees, separate your feet about shoulder width apart, and now lift your pelvis, what you can do comfortably, away toward the ceiling, and then slide your pelvis to the left. And again, sliding the pelvis or translating your pelvis to the left means it doesn't tilt, it doesn't turn, but that your sacrum remains parallel to the floor. That's it. Good. And now slide your pelvis a few times to the right and to the left, and to the right and to the left. Just what's easy. And see if you can feel when you slide your pelvis to the right, resting whenever you want to, the right side of your chest gets a little wider. And when you slide your pelvis to the right side of your chest gets a little wider. You can put your hands on your chest, and you'll find the lower part of your chest to the sides, and you'll feel. It's not a simple thing to feel it, but once you do, it's clear that the shape of your chest changes each time you slide your pelvis to the right or to the left. All right, rest again. And just stretch out your legs and observe that the change in your relationship to the floor is general. It's not that it's in one place or another place. But rather, your entire back is lying differently on the floor. Bend your knees and bring your right arm up near your head and lie your right arm on the floor, just where it can lie on the floor comfortably, easily. And now lift your pelvis towards the ceiling. You leave your right arm on the floor just where it can be comfortable, not uncomfortable, comfortable. And now slide your pelvis again to the right and to the left, and you observe the back of your hand on the floor. And feel, so your arm is lying where it can be more or less straight. That's right. And you just feel, let the floor support your arm. That's right, there's no need. And then you lift your pelvis. That's it, just what you can do easily. And then you slide your pelvis to the right and to the left, and you see if you can feel that when you slide your pelvis in one direction, one of those two directions, your right arm gets the tiniest bit longer. That's right. Feel. Is it when your pelvis slides to the right or to the left? Or you do it this way. When you slide your pelvis to the right, lengthen your right arm a tiny bit. And then you come back through the middle and you let go. And then when you slide your pelvis to the left, you lengthen your right arm a little bit. And feel in which direction, to the right or to the left, is it easier to lengthen the right arm? You feel? One way is easier than the other. Now, switch your arms and continue just simply sliding your pelvis a little to the right and a little to the left. And you see if you can detect that when your pelvis slides in one of those directions, it's easier to lengthen your left arm. And that's exactly the kind of sensing. It doesn't matter whether you know, actually, whether you know the correct answer, which of course can be a different answer than the answer for the person lying next to you. There isn't a right answer. There's a right answer for you. But that kind of making connections and sensing in yourself is exactly the kind of organic process that we all followed, that our nervous system, our brain followed when we were young. Good. Rest for a minute again. Stretch out your legs. Just observe the movement of your lower abdomen as you inhale and exhale. Bend your knees. Your arms are lying on the floor down along your sides. And now lift your pelvis as high as you can, easily, comfortably. That's right. And now lengthen your right arm downwards. In other words, towards your right foot. You lengthen your right arm down and feel which way does your pelvis slide. If you lengthen your right arm down, and then of course you let it come back, and you pause, and then you do it again. But feel, in which direction does your pelvis slide? To the right or to the left? For none of us do we have a spine that's identical to somebody else. And if the organization of my back is in a particular way, I can feel something different than you do. Now, you try intentionally, like we were doing with the arm overhead. You try intentionally slide your pelvis to the left as you lengthen your right arm down. That's it. And feel, does that make lengthening the arm easier or less easy? You feel. And now try lengthening the right arm down and slide your pelvis to the right. And you see if there's a difference. It's not a matter of doing the right thing. It's a matter of sensing and feeling which is easier. Obviously, both are possible. Both are simple. Rest for a moment. And just observe if something's changed, if one side of your, just from those few movements, if one side of your lower back feels as if it's lying closer or further away from the floor, if one side of your chest feels longer or shorter than the other. Bend your knees. And now lift your pelvis away from the floor again. And now slowly, as you slide your pelvis to the left, bring your head down to the right, meaning you bring your right ear towards your right shoulder. That's right. You slide your pelvis to the left, and you slide your head down the floor. Don't turn your head, but bend your head. Bend your head so that your right ear comes a little closer to your right shoulder. That's it. And just do that slowly, many times, resting whenever you need to. And you feel the whole right side of your chest moves, doesn't it? The whole right side of your chest gets a little shorter. That's it. And which arm is getting longer or shorter? Without you thinking of lengthening the arm, which arm is getting longer? Your right arm or your left arm? Good. Rest for a moment and just feel, again, the right side of yourself compared to the left side of yourself. Bend your knees. Raise your pelvis away from the floor, just what's easy. And now slide your head to the left as you slide your pelvis to the right. As you slide your pelvis to the right, that's right, you bring your head down on the left. You feel your chin goes to the right, but your left ear comes down on the left. In other words, you're bending your head. So that's right. So you only need to lift your head a millimeter or less to slide it on the floor. And you'll find that with each movement you can lift the head less. Of course, you don't want to have too much friction. But if your head you open your eyes and just notice, are you seeing the ceiling or are you seeing something to the left or to the right? Are you seeing the wall to the right or the left? Well, then you know you're turning your head and not bending your head. So just go slowly and now feel which arm is lengthening spontaneously. In other words, there was no direction about lengthening your arms, but one arm is getting longer and one arm is getting shorter. You feel that? Again, it's not a matter of turning your head, but of bending. Don't hold your breath. Just breathe easily. That's it. And rest again. Just rest. Stretch out your legs and just observe. Would you say that your shoulder blades are lying on the floor differently than when we started? And your spine? And now bend your knees and stand your feet. That's right. And separate your feet. That's good. And now lift your pelvis. And intentionally lift your pelvis towards the ceiling, just what you can. And now intentionally bend your head to the right and lengthen your right arm. And bend your head to the left and lengthen your left arm. Slowly. That's right. Down. Your palms are facing the floor. That's right. And as you bend your head to the right, you lengthen your right arm down towards your right foot. And then you come through the middle and you bend your head to the left. And you reach down with your left hand towards your left foot. That's it. As your left ear comes closer to your left shoulder. And you feel you're bending. Once on one side is getting shorter, and then you come through the middle, and then the other side of your chest gets shorter. The side that you're bending towards is the side of your chest that's getting shorter. You feel that? And which way does your pelvis slide? You feel it? Your pelvis actually slides, without you thinking about it, is sliding in the opposite direction of your head. You feel that? Your head slides to the right, but your pelvis slides to the left. You feel that? That's it. And maybe do it a little faster. And see. That's right. And let your pelvis swing. That's right. Just let your pelvis swing to the right and swing to the left. And swing to the right and swing to the left. Good. And rest. And stretch out your legs and just feel the contact of your lower back with the floor. Is that different than when we started? We weren't trying to improve something with your lower back, but the improvement is spontaneous. We weren't trying to improve the way that your spine is lying on the floor. You feel? But it's different. And bend your knees one last time. And slowly, you think of that idea of one vertebra at a time, lifting away from the floor and going back to the floor, and feel. Is your appreciation of that different from when we started? That's right. Feel your heels push down towards the floor. That's right. And then you lower your spine one vertebra at a time. That's it. Good. And slowly roll to your side, and then slowly come to sitting. And then very slowly come to standing. And just observe the feeling of yourself. Feel where you can reduce the effort inside yourself right now. Your stomach, your neck, your jaw. And walk around for a moment and just observe something's different in your feeling of your legs, your hip joints. You feel taller or shorter.